Hello, 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 everyone. Welcome to another episode of Sree's Daily Global COVID-19 Show. My name is Sree Sreenivasan, and I'm the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism. I'm honored to convene this international conversation every single day to learn more about various aspects of the COVID-19 crisis. Today, we have a very special show. It's episode number 92. That means we've been on lockdown for 92 days in New York City. We're going to do another one of our very popular Ask the Doctor segment. And we have 4 physicians with us: Dr. Susan Zweig, Dr. Sujana Chandrasekhar, Dr. Marina Kurian, and Dr. Cherisse Berry. And they will be with us so that they can take your questions. Tell us where you're watching from, please. Please hit share. Please tag your friends. There's somebody you know who thinks COVID-19 is over and they need to watch this show. Please do that right now. And we'll bring the doctors on in a couple of minutes. Everyone, please find me on Facebook and share it, and make sure that your friends and family are able to watch. Hi, everybody. Thank you for being here. Tell us where you're watching from. We do something called a global tour where we look at everyone saying hello. So tell us where you're watching from in the comments. They're already coming in, and we'd love to have you say hi to our doctors. And I know you have questions as well, so let's make sure you get a chance to ask them. We also want to thank our sponsors, so let's get right to it. We have a new sponsor, Rutgers Global Entrepreneurship Experience. It's a virtual teen camp. Do you know any teens? There are 2 start dates in July 13th to 17th and July 20th to 24th. They go to globalentrepreneurshipexperience.org. They get to learn from top entrepreneurs and startup experts from Cognizant, Angie's List, Google, Facebook, many others. Use 20% off code SREE, S-R-E-E, and they can learn from the best. Unfortunately, I'm also speaking at the show, at the course, but they don't have to pay attention to me. Much better people are going to be speaking there. So please share this with your friends, anybody who has kids. Take a screenshot or take a photo right now and pass it to them. Virtual, anybody in the world can participate, and 20% off with the code SREE, Global Entrepreneurship Experience.org. Global Entrepreneurship Experience.org. We also want to thank our sponsors at Art & Co. Artandco.net is the world's largest online art auction fundraising for COVID-19 victims. They have 31 artists as well as 7 charities that are going to benefit from this art auction. Even if you're not an art collector, you know somebody who is. Take a screenshot, take a photo, share this with them right now, artandco.net. And finally, we want to thank our friends at Muckrack for allowing me to do this, the Fundamentals of Social Media, a free certification course coming June 17th, but save your seats today. mrac.co/social, mrac.co/social. 3,500 people have already signed up, and so can you. Any experience, any background, any age. We say journalists, PR pros, but anyone who needs to communicate should take this class. It's a great course, not because of me, but because of everyone who's helped make it possible, including Linda Bernstein, my adjunct professor. So please go to mrac.co/social and make sure that you tell your friends to sign up as well. It starts June 17th and it's free, and you get a certificate right away when you are finished with it. All right, today we have a special collection of doctors who are going to be with us. So let me introduce you to them. I'm going to bring them on one by one. I'm kind of warning them because they're off stage. I'm giving them a little heads up before I bring them on. And so first, let me bring on Dr. Susan Zweig. Hello.
Hi, thank you for having me.
How are you? Where are you? That's the question we ask all our guests.
I'm in New York City, still working, but right now, obviously, I'm at home.
And how has the COVID-19 crisis affected you?
I think it's been hard for different reasons, different days. Certainly, we stopped seeing patients for a while, and then different people were doing different jobs than they normally would, covering the hospital or doing other things related to COVID. we just started opening up the office recently and seeing patients again. And then, emotionally and personally, it's affected me like everyone else, not being able to see friends and family, being, sequestered at home. But, I have it okay.
All right. Well, I'm glad to hear that. Tell us what kind of doctor you are so that people who are thinking of questions will be able to direct them to you.
I'm an endocrinologist for adults, and endocrinology is the treatment of glands and hormones. We do a lot of things like diabetes, thyroid disease, osteoporosis, anything with a hormone or gland, cholesterol, weight management.
All right. Well, I have a cholesterol issue, but I don't want to turn this into me asking you for advice. Thank you so much, doctor, for being here. Let me bring on our next doctor. Here is Sujana Chandrasekhar. Hi, doc.
Hi, nice to see you again.
How are you? Thank you. You've made multiple trips to this show. We're so grateful. How are you? Where are you?
I'm good. I finished up a beautiful, long, and fruitful day of surgery today, and thought I'd be, the best laid plans of mice and men gang after glay, right? So I thought I'd be done a couple hours ago. I was done about, an hour ago, maybe 45 minutes ago, but things went very well. It's very, very nice to be back in the operating room with our teams and doing stuff we like to do and helping people hear again.
That's so important. You're an ENT surgeon,
and an ENT surgeon.
And we've said that it matters now because this COVID crisis is in part all to do with the ear, nose, and throat, and this area where things can go wrong, right?
Yeah, and the easiest route to spread, right? So when we talk about wearing a mask or covering your cough or washing your hands, not touching your face, it doesn't mean you can't touch like the skin part of your face. It means that if you have virus on your hands and you touch your eyes, your nose, your mouth, those are easy areas for viruses to get in. And so, yeah, we've been, I think all physicians, all nurses, all healthcare providers have been at the front lines, and each one of us, I sometimes feel like the blind man and the elephant. Each one of us is seeing something different, and we're keeping on trying to communicate to bring that together to an understanding of this disease.
Well, thank you for everything you're doing, and thank you for being here with us and sharing your knowledge and what's happening right now. Just today you were in surgery. That's amazing. All right, we have one more doc to bring for this first part of the show. So please say hello to Dr. Marina Kurian. Hi.
How are you guys?
Good to see you. Thank you for being here with us. How are you? Where are you?
I'm in New York. I'm really good. Today was a scheduled day off for me because it is, or was, my daughter's virtual graduation from high school. So that was very interesting and different. And anyway, it was an experience. And I would say congratulations to any 2020 class. I don't care whether it's middle school, high school, college. This is definitely something that is for the history books about how we celebrate, completely different than I celebrated my son's graduation 2 years ago. So,
and what a difference those years have made. And those of us who
do our best, right? So we did some socially distant, responsible lunching, and then she's with her friends who've all been isolated and quarantined, self-quarantined for weeks on end now. But we did our best. And the schools, all of them, and I've heard from my friends around the country, all of the schools have done wonderful things to try and celebrate the kids, which I think is so important because it is, they didn't really get to experience their senior year, spring term, which is a special time of kind of sort of working, but not really, but being at school and being like the spring term senior. I mean, we all remember that, and they didn't get that opportunity. So, I think the schools do the best they can.
Yeah, and we're thinking of all graduates, as you said. So let's do our global tour, and let's make sure we get questions in from our audience, and also tell us where you're watching from. So Susan hasn't seen this before. We do this global tour where people tell us their comments and questions and where they're watching. And Shronali is watching from LA. So hi, Shronali. And Jonathan's watching from Union Square. He's watched 92 straight days, which is incredible. And these doctors are familiar with him. Rajendra is watching from New Jersey. Hello, it's Science Writer. My dad's watching from Kerala in India. Dr. Zweig, have you been to India or Asia?
I've been to Asia, not India. It's way up on my list. I definitely want to get there.
Great. And I know the rest of us have, but I'm sure you'll get there too. So hi, Acha. Great to see you. Mona's watching from New York. And Shonali says she graduated from Rutgers because Rutgers is sponsoring us today. Sarah says hi. Sarah helped us book a fantastic guest just this week. Her boss was with us, the Dean of Weill Cornell Medicine, and he was terrific. And one of the things that we have learned is that everybody's pitching in and communicating and talking about their work, and that really matters. Susan, if I may, tell me about why you're doing a show like this and being here with us. Why is that important for doctors to do?
I think it gives a personalized approach. We have a different view of disease of someone who's just at home. We're a little closer to it. We also have some knowledge. There's a lot of misinformation out there, and I think it's good for us to be able to talk to our peers and discuss the latest research, see what's going on, and see how it's affecting everybody.
And do you get trained in this stuff? How does it work?
With COVID?
Yeah, no, in like communication and being out there, and does the hospital do that for you?
Not really. I think more and more there are ways, if you're interested in that, there are conferences and leadership things that you can participate in, but it's not something that they teach in medical school or that you're required to do.
That's great, but you obviously are very comfortable doing this, so but you see the value in it, right? That's why you're saying
absolutely,
you do it.
100%.
Yeah, and so tell us about what you've learned in these. What have you seen these last few weeks in terms of medicine, and what you wish everybody knew about COVID-19? People are thinking that this is kind of over, but it's not.
I think that New York, which was hit the hardest so far, really understood how important it was to shut things down and for people to stay home and to wear masks. And it's evident by how our cases have been, continuing to decrease. I wish that some of the other areas of the country saw what happened to us and did the same, because you see some of the areas that didn't shut things down and people aren't routinely wearing masks, the cases are now on the rise. And that's the only way to make this stop. So I hope that, people take it seriously. I think sometimes people believe what they want to believe. And, if you want to believe that it's a hoax and you want to believe that masks don't work, you start doing that. But we have the evidence that it does work. And hopefully, I don't know if it's going to change anyone's mind at this point, but hopefully the more we get the word out there, the more people will believe it.
Yeah, I think you're absolutely right. Let's go to our other docs and ask them. There've been lots of questions coming in about opening up. So Marina, let me ask you, you're dealing in your own home with children who obviously want to get out and are wanting to participate in just life as New Yorkers, life as young people. What is your message to people right now as the opening is happening?
Well, I think we have to separate a little bit. Like, I'm so surprised by how well my kids have stuck to the idea of quarantine, and all of their friends, and none of them ever left the house, and they see each other on FaceTime, and I think I said this on a prior show, they keep in communication. But like, if I needed, if they need something from the pharmacy, I'm the sacrificial lamb that goes out and goes to the pharmacy to pick it up. I'm the one who's going to the store. They actually are like, hey, Mom, go. We're quarantining. And so I truly believe that the kids don't have as much exposure as even, obviously I'm going to the hospital, I'm taking all of the measures that I should be. I'm wearing masks everywhere. And of course, everybody's practicing hand washing. But I think that what I've seen from my kids and their friends, that they've really taken this really to heart. And so they're not really out there. So when I say that my daughters, with her friends, they've all been self-quarantined for these past 12 weeks. That's almost what it is, right? March 12th is when Cuomo was like, we got to rein it in. And it's been that long. And the kids have really been so good about it that I'm so much less concerned. Now, as a healthcare provider, I'm sure both Susan and Sujana have also been tested. I've been tested a couple of different ways to see if I'm positive or negative. My exposure has been less than probably Sujana. My exposure to to at-risk patients, I think. So I think in terms of opening up, I think we're doing it the right way. I actually am a big fan of Cuomo. I think it worked out well. I think what he's doing makes sense. There's a lot of anger about what happened with the nursing homes and what his directives were, but I think that they're trying to turn the tide right now. And overall, I think the state, New York State certainly, and New York City, as I've said on every show, any internet show I've done during this quarantine, I've never been prouder to be a New Yorker, because I feel like most of the people really did everything they were supposed to. I know that I did telehealth from the get-go, like March 17th, St. Patrick's Day to a lot of people, but not this year. This year it was lockdown and it was telehealth. And that's when I started with my patients, and everybody was really taking it very seriously. And I laud them. And I also think that we really did try to look at what evidence we had. And that is really the problem, right, Susan, and Sujana, that the evidence that we have is all over the place. Like first they're like, no, asymptomatic people bad. And then the WHO came out and said, it's kind of low risk. And then they walked it back
the next day.
Yeah, we're not sure, but we think it's low risk. So
I think it was, I think this is the problem, that we don't have so much information. We are all kind of scrambling, but we do, I think, exactly as Susan said, we know that if you practice social distancing, if you wear a mask, and if you wash your hands, you're going to keep this down to a low roar. And healthcare can handle a low roar, right? This is where it's very concerning, because as Susan said, if you want to hear that you don't need to wear a mask and somebody misspeaks at the WHO, you're going to be like, look, see, there you go, I don't need to wear a mask. But the answer is we really do. And I think as we're opening up, I'm getting very interesting questions from patients, from friends, lots of people in the suburbs. When can my kids get into a car with their friends? When can they go for a drive? When can they go somewhere? We don't have enough testing. We don't know who's actively got virus in their nasopharynx, in the back of their nose. We don't know who has or does not have antibodies. Like, I was seeing patients throughout, and I tested antibody negative. I don't know. Maybe I'm positive and I just tested negative. I don't know. And the concern is, okay, so let's say you're in a car with your masks and the windows are down, but then are you blowing sort of a jet stream around in the car? You can take this exercise to some degree. I don't know how to counsel it.
I was imagining everybody hanging out the window like puppies. That's why I was laughing. I don't want the cars, out to the side.
Sunroof.
Yeah.
Susan, we'd all just be prom girls and be hanging out the top of the car, right?
Right. So, Susan, there is so much confusion, right? Because not just the WHO joining in, but also there's a very prominent doctor in Italy, in the north of Italy, which saw way more COVID than the south. And also, our family has family in Abruzzo, which is sort of mid and due east from Rome on the Adriatic. And they also didn't see a lot of COVID there. But the doctor in the north said that the virus has mutated and they're seeing much, much less COVID, almost to the point where they feel like it's eradicated. And that's something that gives us all hope that, hey, maybe that could happen here. But we're also a much larger country than Italy, obviously, way more people. What have you seen those reports, Sujana or Susan, and what do you guys think of that?
The only thing I heard recently was kind of the opposite, that there wasn't a lot of evidence that it was mutating. So it can be good and bad. If it's mutating in the sense that it's less virulent and it's not going to spread as easily, that's great. But if it mutates too much, that a potential vaccine wouldn't work on all cases, that makes me concerned. I think we just don't know the data. And I think part of the problem is a lot of the data that's getting out there is not always from the best sources. It's not even in some of the top journals, they're not being properly vetted like they normally would. So I think we really have to look at the information. And, this is all new. And some people want answers right away and they get mad. Well, you said you could do this, now you can't do that. I think we're updating it in real time. And the more information we have, then we'll know.
So I have a question for you, Susan, because I think people are concerned about who is actually immunocompromised and who isn't. So you take care of a lot of patients who are either on chronic medication or have some degree of immunocompromise, like the type 1 diabetic who needs insulin, or the insulin-dependent diabetic, the non-insulin-dependent diabetic, the person who's on osteoporosis meds. How do you counsel your patients as to what kind of risks they can take in terms of going out with a mask, with some social distancing, but how, because we all know about the mental health of actually going out and interacting with other people, even if it's just the cashier at the grocery store. So what advice are you giving as to degrees of risk for your patients who are on chronic medications?
I think we have to take it by what their condition is. We do know that obesity, diabetes, hypertension, heart disease, chronic renal disease, these are all been shown to have a higher risk of a poor outcome, and certainly with advanced age. So those are the people that, we really stress you should be at home, try to just get things delivered. If you do go out, wear a mask, wash your hands. I tell them once you take the mask off, then you have to wash your hands again and stay home as much as possible. But, it does take a psychological toll as well. And today was a video visit or a telemedicine day for me. And I spoke to a couple of my older patients who literally have not been outside their apartment in 3 months, like not once. And it was taking a psychological toll. And, now that the cases are really down compared to what it was 3 months ago, I told them, I'm like, you have to go outside. I counsel them. I said, listen, wear a mask, wash your hands, don't get in an elevator with anybody else. Go out, go for a walk, either by yourself or a socially distanced walk with a friend. And then when you come back home, wash your hands, take off your mask, wash it again. But it's not mentally okay to just stay home by yourself all day, every day for months on end. You have to weigh the risks and benefits. In the beginning, when cases were high, I wouldn't recommend that. But now I think to go for a walk and the nice weather is good for all those conditions.
Yeah, I would totally agree on that. That is true. I think, for all of us, when we do these telehealth, it is very important to add that element of exercise and sunshine, to just get out and even walk. Those are really basic things that we need, to be outside, and the human condition is really a social condition. We really do need that interaction. And so especially if you have someone who's older patient or lives alone, it can be very, very difficult. And the estimation is that the mental health issues that come out of this are already, super high, and they're just going to continue.
Here, we have some comments that have been coming in. We just have a few minutes left with Dr. Zweig, so we'll make sure we ask her a couple more things. But Shaurya says, thank you, doctors, for existing. So that's, I guess, a compliment. That's nice. We have Jane is writing on LinkedIn, and I want to thank our friend Paula, who's commenting and posting on LinkedIn with us. When you say mask, we all don't have N95s. What are the next best thing? We're all trying all cotton, snug fit, with no added filters. Dr. Zweig, what do you think?
I think if two parties, both you and the person around you, is wearing masks, studies have shown that the risk of transmission is dramatically decreased. I think the thicker it is, the better, and there's various degrees. The N95s, unless you're actually get what's called an official fit test that's showing no air is getting in or out, any of the other masks are good. Anything that's going to decrease the spray and decrease what's coming in for you. Remember, what you're wearing is not just protecting you, but it's protecting other people. So it's a selfless thing to do, to wear a mask, so that you, in case you have it and don't realize it, that you're not giving it to somebody else.
Thank you. That's great advice for folks. We just want to look at some of the various comments coming in here. Joy's watching from Santa Fe, New Mexico. You know, the problem with these people watching from all over is that these are the places I want to go, and I'm like, oh my God, I haven't gotten a chance to go. I want to go to
Santa Fe.
I love Santa Fe. It's really good.
Oh, you have been?
You
Okay.
can go. And now we have somebody to visit there, so that's good.
Yeah, exactly. That's right. And here's Ritu says, I'm working on an article on health issues that plague South Asians. Do you see different readings for different ethnicities leading to misdiagnosis? For instance, if you have thyroid, TSH readings are normal, but you have tenderness in the throat and raspy voice. How can one put a finger on a malfunctioning thyroid? Who can answer this here in this group?
Susan.
Susan
Well,
can.
actually, both. There's usually, often if you have a raspy voice or a tender, I think you need our ENT expert here. We don't really see differences in TSH in different ethnic groups or thyroid disease. Other things like diabetes tends to present differently in different groups, not so much with thyroid disease.
Yeah, I actually think I think that's very important. So people think because your thyroid is sitting here at your neck that that's going to affect your throat or tenderness here. Normally it does not. So people who have a hoarse voice that lasts longer than a few days after a cold or maybe a couple of weeks, you really should go in to see your local ear, nose, and throat doctor to have your larynx looked at. We can look at your larynx, either your voice box, either with a mirror in your mouth or with a little scope in your nose right there in the office, because you want to make sure there's nothing else going on. But Susan's right. Normally, a normal thyroid disease won't cause a change in your voice quite suddenly like that.
Susan,
Go ahead. Marina.
Before you go, I especially from an endocrine standpoint, you and I do obesity medicine as well as surgery. I have to see my patients regularly. What have you felt? Any trends or seen anything unusual about the pandemic and telehealth? Have the patients been coming in, especially if we're prolonging our phase 2 and phase 3, phase 4, certainly in the New York City area, to much longer? And out through the end of July, how does that impact care? I mean, I have my own druther and preference, and I think it's very important for patients to come in and be seen or do telehealth. What have you seen? Any trends? Anything concerning? Anything you want to warn the patients about?
It's funny. We just started opening up the office to actually see patients in person recently, and I was surprised with the amount of older patients who actually wanted to come in. Part of them are just not comfortable with technology, even if we walk them through it. I think part of them also want to actually be examined. And there's something that's lost when you're just talking to someone through a screen, but it is much safer. I was really glad that we started telehealth right away, so that nobody was getting missed visits. What I did notice is that a lot of patients who were supposed to do certain tests, whether it was radiology exams or laboratory tests, maybe didn't want to go have those done, so they were postponing their visits from that standpoint. And I was glad that the older patients or ones with risk factors stayed home. I'd rather talk to them on the phone than have them risk public transportation or getting sick. The thing that's weird I've noticed from seeing patients in person is that I'm wearing a mask, a face shield, they're wearing a mask, and you can't really show any expression or communicate with them. So especially when I'm doing a new consult, it's hard to see how I'm feeling, how they're feeling, or to show emotion with just your eyes. And I find that kind of strange and something to get used to. The emotional part and the connection with your patient is lost when you're only seeing, this much of each other.
That certainly, I can imagine that's hard. I've not been into a doctor's office yet, but I know that could be hard, because even when you're walking on the street and you see a friend, they can't see that you're actually smiling. You communicate so much with your face. Just want to get to a couple more questions before we let you go, Dr. Zweig. Let's see here. Jonathan says, for a lot of older patients, seeing a doctor is part of their social life, and that's what they're used to. Macron has a I guess, a video on PPEs and masks and educating folks on that. So that's really nice. Bala has a question. We may not be able to answer this. Due to old age, my mother's osteoarthritis. She's suffering with great pain. Please tell me a remedy, physiotherapy, laser treatments, or do any of those work? And we should say that we're not giving actual medical advice. You should always talk to a physician, and that these doctors don't speak for their institutions. They're just giving us general guidance. So with that, Dr. Zweig, what would you say on that particular question?
Well, none of us are rheumatologists or joint experts, but I'm always for the least invasive first. Physical therapy, I think, does wonders for a lot of people. Exercise and strengthening muscles and joints and ligaments, around the ligaments. And certainly if that doesn't work, then to see a rheumatologist, that's the type of doctor that specializes in arthritis, and they could determine whether further treatment is needed.
Thank you. We have a second rheumatoid arthritis question. Does low impact exercise on a mini trampoline or rebounder, is that good for people suffering from arthritis? Does anybody here know that answer?
Jumping is usually not the best exercise for a lot of people. It's a lot of pressure on joints, but again, I'm not a joint expert. Just someone who exercises.
That's pretty good.
I think that a lot of joint care is atraumatic. So stretching in water or hot water baths often. But Dr. Zweig is right. Usually we advocate against jumping or jarring movements at the joints.
Especially if there's osteoporosis. Then don't do it.
Yes.
Plyo's not that great for the joints.
Okay, we're going to, before we say goodbye to Susan, we're going to have Dr. Cherisse Berry join us, and they're going to swap spots there. And I just want to thank Dr. Zweig for being here, but I wanted to say hello to Dr. Berry. Here she is. Hi, Cherisse. How are you?
Good. How are you?
Thank you for being here. Where are you? How are you?
Thank you for having me. I work in New York City, but I do live in West Orange, New Jersey.
And you're a trauma surgeon.
I am. I'm a trauma surgeon, and we call it acute care surgery. So emergency general surgery, trauma surgery, and I'm a surgical intensivist.
Okay, we will talk about all of that in just a minute. Before Dr. Zweig leaves, first of all, I want everyone to see how unusual this is to have 4 women doctors on a show like this. We're so grateful that they could be here, spend some time with us. We're very grateful. Dr. Zweig, let me ask you, in terms of being a female doctor, do you find that there are opportunities that you may not be getting, or where there is the women face some kind of discrimination in the medical field?
I think all of us have been in the game, so to speak, for a long time, and we're kind of used to it by now. Now more than 50% of the medical students are women. So it's definitely changing, especially in the field of endocrinology. When I originally would go to conferences, it was all old men. Now it's all young women. So the face of medicine is definitely changing. And I think probably I can speak for most of the people on the panel that we've learned how to hold our own. Sometimes you still look around the country and in general, and leadership is highly male-based. But as you can see by your panel.
Yes, and I definitely appreciate it. So, Dr. Zweig, we'll let you go. I know you're on social media, but I don't know how comfortable you are sharing how people can get in touch with you, or if you want to just tell us about where they can find you for the work that you do.
So I'm at NYU Langone Health Medical Center, and you can find me that way. And I look forward to helping anybody who has an endocrine issue. And
remind us, what are the things that people reach out to you for?
I see a lot of patients with diabetes, thyroid disease, osteoporosis, fertility disorders such as polycystic ovarian syndrome, obesity, anything with a hormone or a gland.
So you must certainly be busy all year round. All right. Well, our guest has been Dr. Susan Zweig. We'll say goodbye, and we'll have the other doctor say goodbye to you.
Thank you for your
Bye, Susan. It was lovely talking to you.
Likewise.
And we had that exchange earlier in the prep that the two doctors from NYU didn't necessarily know each other. Cherisse and Susan hadn't actually met. It's a big place with a lot of doctors, right?
Yes.
Yes.
Well, now if this ever ends, we'll have to go out to dinner.
Yes. Definitely.
That's
Outside.
awesome.
We got to sit outside.
Absolutely.
Thank you, Susan. All right, we now are with Dr. Cherisse Berry. Thank you for being here, and thank you for sharing your wisdom and insights. Tell us a little bit about how you've been affected by the COVID-19 crisis. What kind of work were you doing? How did it change? And then we have lots of other questions that we want to ask you too.
Sure. So as I was saying earlier, I am a trauma surgeon and an emergency general surgeon, as well as a surgical intensivist. And so when we began seeing the surge of patients, specifically at Bellevue Hospital, we immediately had to make some adjustments. So we normally have, emergency general surgery that comes in. We had to allow our other colleagues to take over those cases so that we could sort of focus in on the really critically ill patients that were both medicine and surgical. And so we had to sort of divvy up the hospital, create space where there wasn't space to try to fit all the patients that came into our hospital. And we had just such an amazing group and staff that worked incredibly hard to get that, to make that happen. Creating new ICU spaces and being able to house all these patients that came through our door. So, we all sort of took on different responsibilities, but we got the job done.
I spent 2 years, my first 2 years of training in general surgery at NYU Bellevue. And some of the most fun times of my life were in the trauma bay at Bellevue Hospital ER. Just very exciting, doing good things for people. But, on a normal day, the Bellevue ER is just jam-packed. And I remember a guy walked in and said, "Oh yeah, somebody stabbed me in Times Square." So I took the subway and I walked across town and I came here, and then he collapsed. Funny things happen at Bellevue, things that you only ever read about in a book somewhere. How did you manage in the acutest phase of COVID to take care of the super sick COVID patients, while also, like you said, you divvied up who took care of whom, but how did you even separate the non-COVID or the not likely COVID who needed acute care as well? How did you manage in that space to make it happen? How was it? Doctors in charge, nurses in charge? Was it collaborative? I think we're learning a lot about how we manage healthcare overall from this crisis. I'm wondering how you guys did it.
That's a great question. It was incredibly collaborative. We ended up separating our COVID patients from our non-COVID patients. So we had one floor, which housed most of our ICU patients, became sort of the COVID critically ill floor. And then our non-COVID patients went to a different part of the hospital. And we did the same thing down in our emergency department. So those that were COVID patients were in one area, and those that were non-COVID were in a different area. I think it was very interesting that as the surge took place, we didn't see a lot of traumas. We didn't see a lot of non-COVID emergency patients, which we all were wondering, what happened to the non-COVID volume. And the only thing that we can sort of determine is that perhaps people just stayed home, which, our entire hospital was almost all COVID patients at one point. And so, I think that happened at quite a few different hospitals, not only in New York, but across the country.
Cherisse, one thing you just said, that we weren't seeing as much usual general surgery or other illness. Like, people weren't coming in with pain in the left lower part of their abdomen, right? Like we'd say diverticulitis. They weren't coming in with right-sided abdominal pain, which could be gallbladder, could be your appendix, right? So, but what I did hear from some of my colleagues, and certainly you being on the front line of all that, may have seen it as well, that everyone was seeing now not early appendicitis, but perforated appendicitis, and not seeing easy diverticulitis that you treat with antibiotics, but now you see somebody who has an abscess or needed further therapy and would therefore be in the hospital for longer, which I think is some of the dangers that people need to recognize. If you have pain, you still need to reach out to, if you're not feeling well, reach out to your primary care physician. If their offices are closed, they always have a backup. In this area, CityMD, I think, helped a lot of people as well, or an urgent care center, because people were afraid to go to a regular ER. So I think it's so important to underline that if you're not feeling well, you still need to get checked out. You can't just ignore it.
It's absolutely. I was actually on call last night, and I
had no idea.
No, it's okay. It's okay.
Brilliant.
I should have been a trauma surgeon. What's going on here?
Well, no, I ended up seeing a patient for appendicitis, and ended up being, an infection of the appendix, and it was so far along that it involved the colon. So it ended up, an operation that typically takes, 30 to 45 minutes, ended up being a much more involved operation. And it didn't need to be, because I think people are just afraid to come to the hospital. And if I can only say one thing, it's okay to come to the hospital. You're going to be met with people that are in masks. They have set up areas in the hospital where, you don't have to worry about, getting COVID. We're all in masks. We're all in our PPEs. Don't wait. If you are in pain, if you need to see a doctor, please come see us.
And it's not just pain. If you're short of breath, all those things, all the things that you normally would be like, I'm gonna call my doctor. Well, call your doctor. And if your doctor's not there, there has to be somebody covering, or there'll be a message on where you can go. But also the urgent care centers in the areas are still available.
Yeah.
And a lot of us have opened up our offices, right? So I think part of the reason why, my office, we saw emergency patients in that first month. We did a lot of telemedicine, but we wanted to save the ER for the people who needed the ER, right? So if I could take care of your bad nosebleed in the office, or your bad earache in the office, or your foreign body somewhere, or whatever, I'd rather take care of it in the office. But then if you needed to go to the ER or the hospital, we were able to get you in even when COVID was at its peak in this area. I think by the same token, one of the people earlier, Cherisse, had asked, oh, what do you do about this hoarseness? Well, untreated hoarseness, unrecognized, could be bad reflux of acid from your stomach, but it could be an early cancer. So you need to come in and have us take a look at you. And, we took a pause to see what we do that's important and what we do that could be delayed. And it turns out doctors, nurses do a lot of important stuff. So I think coming in to see us, whether it's in the office setting, whether it's in the emergency urgent center setting, or in fact, if you're having shortness of breath, chest pains, abdominal pains, something that needs to be seen emergently, you need to go to the ER. And I think patients should understand, both in the New York, New Jersey area where we're just starting our recovery phase, but in fact, in other parts of this country and this world where the cases are still on the upslope, I think people have to understand that the healthcare facilities are making sure that they will be as safe as possible when they get there.
Absolutely. I know when you register, their plexiglass that's up. People are keeping their social distancing. Everyone has on, masks, gowns, gloves, and that's throughout the hospital. And so, it is safe to come to the hospital, and I encourage everyone to come that needs to come.
I think it's also important to recognize that this has been a learning curve for everybody. And I think I said on the last show, right, Sujana, that this has just been a treasure trove for the researchers, even though there's been some bad research that came out of it or some confusing information. But in general, we're all kind of learning as we go what works, what doesn't work. And I think that what I've found from talking to the residents and the nurses that have been testing people that have worked throughout this entire pandemic, in labor and delivery, in doing the actual screenings for staff and patients coming in, is that they've taken such precautions that they haven't actually gotten sick. So I think early on, when it wasn't as clear, there were some people who got ill from the disease. But I would say that in the past, I want to say 8 weeks to 9 weeks, we found that the teamwork, the washing the hands, wearing the protective gear, identifying, now that we have better testing and more access to testing, which maybe Cherisse, you can talk a little bit about that we've identified people that, definitely go home. You're not welcome here. Go home. If you're a staff member and you're not too sick, you can go home and recuperate at home. But we've been able to identify people who are at risk, people who are in the clear. And because of that, we've been able to sort of get an overall plan and prevent the healthcare workers from getting super sick with it, which is what we saw in China and in Italy, that early on when they were trying to figure it out, that they had a lot of healthcare workers that end up contracting the disease and getting sick. Not to say that we haven't, we certainly have. But
Sure.
from what I've been hearing in the past few weeks, it's been less.
Well, I can definitely speak, for Bellevue, before you can enter the hospital, you get your temperature taken. And so if your temperature is elevated or high, then you go through a screening. And so, it's really about being symptomatic or having symptoms. I can say with all my partners, we've all taken care of so many COVID patients. We've operated on them. We've taken care of them in the ICU and their critical illness when they've improved and eventually gone home. And we're all healthy. I'm very grateful for that. But, through all of that over the last 8 weeks, we are all healthy and not contracted the virus.
And also, you have a family, you have kids. I know I follow on Twitter, I think Grady Doc. And she, has this whole process that she detailed on Twitter about what she would do when she came home and how her clothes were in the washer and she had already had like a decontamination shower. She wouldn't even come into the house really to see the kids or forget kissing your husband. That's how you don't hug the kids. You're like
that.
So which is harder when you have small kids, but you were able to not only keep yourself safe, which is I think hopeful for people to hear. You were able to keep yourself safe and also keep your family safe.
Yeah, so I have a 9-month-old son and I have a 3.5-year-old son. And so I have a pretty rigid home decontamination protocol that I go through. I immediately take everything off that I've been at the hospital, shoes, everything. I go downstairs, I take a shower, put on clean clothes, and then that's when I say, "Hi, I'm home." Now I can hug you, kiss you, engage and play, and I just want to make sure that I'm not, taking things from the hospital into my house. And
it's interesting because as this pandemic started, my dad's an ENT surgeon, and he had that routine my whole life. Like he would just come home from the hospital. We're Indian, so the shoes are off at the door. And then he would just go right. We'd be like, "Oh, hello, Appa." And then he'd go to his room, strip, change, home clothes, and then, everybody was together and happy. And it didn't dawn on me until this pandemic started. But that's really what I thought you did. I thought you just washed the hospital away when you walked in the door and you just came home. And we've taken it now to a more careful level. And I think civilians, non-healthcare workers are understanding the need to, when you come inside, leave your shoes at the door, take your mask off, wash your hands really well. And, maybe that's good for us. Mark Lee, who is just terrific. He's one of Shree's regulars, and he runs a talk show. He's talking about the almost the inequity of testing facilities, where there are some areas where there's a lot of testing and many areas where there's not a lot of testing, and maybe we really are only testing symptomatic people. And then he also mentioned that he sees doctors walking around without wearing masks and without really doing social distancing. And in many ways, we are the worst patients, but I think most of us are taking this seriously. I will tell you, Mark, from my perspective, now that we're back to doing elective surgeries, we are testing all surgical patients, whether they're elective or emergent. And so we are having a baseline, but that's kind of a high bar if you have to have surgery in order to be tested. And I'm wondering if Cherisse or Marina has some idea about how we test better, or how we get more of a sense of where our community is in the communities where we live.
I think it has to do with testing, right? I mean, we are testing all of our patients. We've been tested. I've had the PCR test, which is through the nose, and let me tell you, that is not pleasant. Not.
Hey, that's where I live. The nasopharynx is my home.
I don't think you can make it even a better situation. I love you, but there's but I did it. I got through it. I actually had to hold my patient's hand because she couldn't do it, and literally she was scheduled for surgery, had done all this pre-op stuff to get ready for it, and was going to walk out because she couldn't do this test. She just couldn't. And I just held her hand. I talked her through it. We ended up getting it done. So it's totally, I know I said it was terrible, but it's uncomfortable. Not fun. And then I also did an antibody test, and I was negative. And at some point, you kind of wish, like, well, positive would have been something. Cherisse, how's it going in the the city programs as well, like, and reach out to the communities. It's important.
Yes, I think that right now the testing has gotten significantly better. I think early on, everyone was sort of following the CDC recommendations with you could only get tested if you had certain symptoms. I think that was missing a lot of people. But now there's so many different places within the city where you can get tested. And so I think that we've made significant progress. I know at Bellevue, we test everybody before surgery that comes in for traumas. So I don't think that that's going to be an issue anymore. And I think as we gather that data, we'll be able to get a better understanding of the disparities that exist in COVID.
Folks, this is such a great conversation. I stepped away because it's so unusual to see three doctors like you talking and sharing such great information. But we do want to note that it's almost 10 p.m. here on the East Coast, and we know you've all had a long day, and we want to make sure we also get in some of the comments. So just let's take a look. J. Roll says, do you think that most primary care physicians should have shut down as they did in Massachusetts? J. Roll says, I think it was an appalling disgrace. I guess what happened in Mass, they shut down the hospitals? Primary care, didn't they shut it down everywhere?
In the beginning, almost everywhere, the private offices closed because we really did not have an idea of how things were spreading. We did not have access to PPEs, which is personal protective equipment for our staff or the physicians or the nurses or the ancillary personnel in our offices. And we really, you cannot be seeing patients who are potentially contagious when your front desk staff is not equipped to have a barrier against spread. And within the offices, we needed to set things up. I think many offices relied on, we have a number of offices. I work with ENT and Allergy Associates, which is 44 offices in the New York area. So we assigned in each regional area one office that stayed open for that first really awful month for emergency visits. But I think what happened is we rolled into telemedicine. We were all learning as we went along, and I think that patients should never feel like their physicians are abandoning them. I don't think anyone ever meant to abandon their patient, but I think we have to make sure that we can take care of our staff and our patients and keep everybody safe when we're seeing patients in the office.
Thank you. Let's keep going. Monica says, yay to female doctors. Well, we have some news at the end of the show about female doctors that we're going to share with you. So please stay tuned. Nobody leave. We have some things special to share with all of you, but let's keep going. And this is a question I guess everybody here can understand. Do you think first years now are coddled compared to what you experienced? So I guess there's a chance for you to say something either super nice about your junior doctors or just like everybody else does, go after the younger generation and say, you guys are so much better than they were.
Well, you know, Cherisse and I are biased, I think. We have some great residents at NYU. I also have great residents at Lenox Hill. I'm at 2 different hospitals. And I think that we are all working within the confines of what we consider to be appropriate medical education right now. And what has changed is that framework of how we were trained. You know, Sujana and I trained in serfdom. You're an apprentice and then whatever, you know, I can't remember the order, but it was just like, that's what you did. And that's not what it is now. And I think that that's appropriate. I don't know that it's coddling. I think it's really addressing an appropriate way to learn versus, you know, what we went through. I mean, we learned, we certainly did, but I think that that is why there's all these education doctorates and PhDs, because there's actually better ways to learn than how we did it.
Well, go ahead.
No, go ahead. I'd love to hear.
Yeah, no, I agree with Marina. You know, as a med student, we weren't really there was a long time ago, but we weren't really protected by a certain work hour limit. And so, you know, you could easily spend over 100 hours, you know, in the hospital. And, you know, I think we've reached a point now, well, A, we can't do that anymore. And B, having a work-life balance, I think, is very important. And I think it makes you a better doctor. And so, you know, I think, you know, we have phenomenal residents and it's a very pleasant environment. It's not malignant. And that's just the way to learn. There's no need to, you know, create an environment where, you know, making people feel bad or it's, you know, it's not coddling. It's just being professional and having respect for everyone.
Thank you. I just want to read.
Yeah, I agree. You know, we grew up in a funny time, Sree. Like it was it was awesome. It was great. I said some of my favorite times were at the Bellevue ER as an intern, right? I loved it there. But, you know, I remember Dr. Spencer said to us, oh, the thing that's wrong with every other night on call is you miss half the good cases, right? That's what and I was like, okay, I'm sorry, sir. I have to go home between midnight and 4 a.m. and then I'll come back and work for the next 2 days. And we were called house officers because they actually lived in the hospital, like truly lived in the hospital. And I absolutely agree. I think our interns are frankly much smarter and much more balanced in their lives than we ever were. And I think they are in a position where they can truly learn. And I think we are very fortunate that as we get older, those first-year residents will be our doctors. So I'm actually very grateful that medical education has come forward like this.
Come on, you guys are all too nice. You're going too
okay,
nice.
We were way better.
All right.
When men were men and sheep were scared or something.
Right. Yeah, exactly. Tim is watching from Northeast Pennsylvania. I just wanted to read you Paula Kiger's tweet. She said, thank you to doctors Marina Kurian, Susan Zweig, Sujana Chandrasekhar, and Cherisse Berry for joining us, for sharing your expertise about medicine, patient relationships, and COVID-19. I completely agree. That's really great. We had a question here from Candace Berry. I don't know any relation, but Candace says, do you all feel it will be okay for schools to open in the fall? We'll ask Dr. Berry.
Well,
first of all, any relation?
That's my sister.
Okay.
I'll say. You know, I think it's, you know, we're starting to learn that children, you know, can be affected by COVID. And we're seeing more and more children that are affected. So I think, you know, it's hard to say. You know, I am not sure. I haven't decided if I'm going to put my son back in preschool until there's a vaccine. And you know, I think it's I think the jury's out right now. And so I think we need to learn a little bit more about how children are affected.
Thank you. Let's keep going with some of these questions coming in, and then we do have to wrap up. My mom's watching from Kerala. Your sister's watching, Dr. Cherisse. My mom's watching in India, and it's just great to see all these questions. People are asking about other aspects of the crisis, but I want to ask you, Dr. Berry, before we let you go. We talked earlier about kind of the sexism that female doctors sometimes face. What is it like to be a doctor of color? And what are your feelings right now with everything that's happening in this country? There are signs of change happening. We woke up to the news that NASCAR is banning Confederate flags. We woke up to the news that HBO Max is pulling Gone with the Wind and will be putting it up only if they can have some context to it. Confederate statues being brought down. What are your feelings about all that's going on right now?
I am excited that we seem to have had an awakening to the systemic racism that plagues this country. Like everybody, I was horrified by what I saw, which was essentially a public lynching. But I am encouraged by the diverse multicultural response to justice and change. And so I really do believe that we are on the road to being a better country, and so that we don't have to see those images ever again. And so I'm excited. I'm encouraged, and I'm excited by the changes that are coming.
Thank you so much for sharing that. I know doctors keep their emotions in, but I'm glad to see that you see hope at a time when a lot of people have been so down. But those protests were something to behold and to see. Let's see, we're going to give each of our doctors a chance to give us a final thought for now. So we'll ask Dr. Berry, and then we don't want to keep her. She has her kids and everything. So why don't we have her say goodbye, give her final thoughts, and we'll let her step off stage.
Sure. Again, thank you for having me. I really enjoyed being here. Just want to encourage everyone to wear your masks. Don't be afraid to come to the hospital. We are here to treat you, and it is safe to be seen in a hospital. And again, thank you for the time and for the opportunity to be here.
Oh, thank you. And how can people find you? People don't want necessarily to meet a trauma surgeon. If they need a trauma surgeon, you would be a pretty good trauma surgeon to find. So where can they find you?
You can find me on Twitter at C Berry Trauma MD.
C Berry Trauma MD. All right. Very good. Thank you very much, and please be safe out there.
Thank you. You too.
All right. Bye-bye.
Bye.
All right. They were terrific. These are your friends. You brought them to us. Thank you. I'm so grateful. And now we want to tell everybody, no one leave, because we have some very important news to share with all of you. And that's about what you have been seeing today. You saw earlier a comment about how nice it is to see women doctors on the air. And that was a very nice comment we saw. And there's Monica's comment. And that is part of what we wanted to tell all of you, that we have some news. And I'm going to ask Sujana to tell us the news as we show you what we have in store for everyone.
Well, Marina and I are very excited to partner up, having been friends for a long time, to partner up officially to launch a show that will air on Sundays from 11 to 12 called She's on Call. And it will be Marina and myself talking about medical topics of the day, of the week, inviting some really great speakers to come by, mostly physicians, maybe not physicians, depending on the topic we want to talk about. We'll be talking about medicine in general, healthy activities, and of course we'll talk about COVID. But we're really excited to put this together, and we really hope you'll join us. It'll be in this same space on Sundays from 11 to 12, and our debut is this Sunday. So Flag Day is also She's on Call Day.
Let's tell them about the doctors who are taking on.
Yeah. All right. So this week, our premiere show, our guests will be Dr. Dara Cass, who started a group called Feminem, which is an enormous group of powerful women in medicine. And Dr. Cass is an ER doctor who will bring us her insights, both about what's happening in hospitals and in emergency rooms, but what's happening in the world of organized medicine and organized change in medicine. And we have a trainee, we have Dr. Hafia El-Tihar, and she is an ENT resident at New Jersey Medical School, and she is going to be talking to us about what it was like to be pulled from her regular ear, nose, and throat surgery training to take care of COVID patients, what it was like to grow up in the South as a Somali American, and what it's like as she foresees the way medicine is going in the future in the United States.
That's so exciting, and I'm delighted that you're doing this. This is exactly what I think people need to see, women talking about showing off their expertise in areas that we don't always see on television. And so we're doing our own here, and I'm just delighted that you're able to do this. Marina, how are you feeling about this?
Oh, I think it's fantastic. Sujana and I have known each other, as you said, for many, many years, people. Let's just be real. We've known each other for a while. But we're not stuck by hanging out all the time, but we reconnected actually through Sree. And, Sujana also sees my folks, but separate thing. But it's nice to meet like this, and what we've both discovered is that we really are able to explain a lot of the medical jargon and the lingo to our patients and our friends and colleagues so that they all understand. And I think that that's important when you get bombarded with all this medical noise and you're not sure how to keep track of it or what to really say is like maybe a voice of reason. And I like to think that the two of us are true voices of reason.
You are voices of reason, folks. The show is called She's on Call, and it starts this Sunday, June 14th, 11 a.m. to noon. Everyone, please follow She's on Call on Twitter, on Instagram, on YouTube, Facebook. We're still populating all those channels, She's on Call, and we're just delighted that we can partner on this. I'm not going to be on camera. I'm just going to be behind the scenes pushing the buttons and taking orders from these ladies as they tell us and share with us their immense knowledge and wisdom. So we're grateful to everyone for being here and for encouraging them. And I know they'll be looking for doctors to come on the show and other experts to come on the show. They'll be looking for sponsors and all of that. And my team at Digimentors is really honored to partner with them and very excited with what they're going to build and what they're going to show all of you. So please tune in again. Just a reminder, everyone should take a photograph and share this with their friends and family on Sunday at 11 a.m. Eastern time. And that'll be a time that people all over the world can watch, and also people on the West Coast can join as well. And we should also say that the hashtag is going to be She's on Call. And we'd love your ideas. And our friends at scroll.in, one of India's leading news and independent culture websites, is going to be live streaming this at the same time. So they have millions of followers on social. And we want to talk to sponsors who want to support this kind of accurate information going out into the world. These two doctors have helped so many of my viewers over the last 92 days. Marina was an early guest, and so was Sujana. And then I have a spin-off radio show on WBAI, and Marina was my very first guest. And so I'm so grateful to both of you for all the wisdom and insights you've shared with me and my audience. And now you're like going off. I hope you'll remember us and come back on our show once in a while. And we wish you the very best. So I'm going to say goodbye to both of you so you can get back. And I know that we have a planning session right after this, so we're going to get to that. And I'm going to say goodbye and thank my sponsors, things that you'll be learning to do yourselves, but wish you both the very best.
Thank you so much, Sree. It was another great show. Thank you.
Thank
See you all on Sunday.
Yeah. So see you. Bye-bye.
Guys.
And another show comes to an end, 92 in a row. I want to tell you about our 93rd show, which is going to be tomorrow. And it's a very important question about what it's like to be an African-American in this country and witnessing trauma, witnessing a protest. What is happening there? So the topic is called Bearing Witness While Black. Alyssa Richardson, PhD, Dr. Ali Black, author of Bearing Witness While Black, African American Smartphones and the New Protest. She's a scholar of race, digital activism, and the press at USC. She'll be with us for the hour, 9 p.m. Eastern, tomorrow, Friday. Everyone, please mark your calendars. Please share with your friends so that you can join us. We want to thank our sponsors, Rutgers Global Entrepreneurship Experience Virtual Teen Camp. Learn from top entrepreneurs and startup experts and use the code SREE for 20% off. globalentrepreneurshipexperience.org, globalentrepreneurshipexperience.org, 20% off. They start in July. There are 2 sessions in July. I know you will benefit from, any teenager you know would benefit from this. So globalentrepreneurshipexperience.org, use the code SREE, S-R-E-E, for 20% off. We also want to thank our sponsors, Art & Co. Get involved with the world's largest online art auction fundraising for COVID-19 victims, artandco.net, artandco.net. And finally, we want to thank Muckrack Academy for allowing me to create a free course for all of you, Fundamentals of Social Media, open to everyone, not just journalists and PR professionals. Free certification course starts on Wednesday. mrac.co/social, mrac.co/social. Please join us. Please take a photo. Please share this with your family and friends. Any age, any background, any experience. 3,500 people have signed up already. We want you to sign up too. We'll just glance at the comments here. There was a comment saying, why aren't you asking Russia for the cure, as if Russia has the cure? Let's see who else is watching. Anand says, thank you for the show. Jonathan says, great show. And we're just so delighted that everybody's been able to be here. Paula did an amazing job on LinkedIn, connecting everybody there. And my dad says hello to Dr. Kurian. And Makran says, she's on call, yay. And that is pretty cool. So Paula is also sharing the information about the show. She's on call, starts on Sunday, and that's a spin-off show of all the kinds of things that you've been seeing that we've been covering. And we're so grateful to Sujana and Marina for doing that. And it's going to be awesome. So thanks very much, everybody. I'm going to say goodbye, and we'll see you soon. Please stay in touch, Sree@Sree.net. We're looking for guest speakers, sponsors, themes. Email me, Sree@Sree.net.